Hey guys, Dr. Dana here with Love Health. I want to update you and just give you some quick statistics about what's happening right now with viruses and why it's so difficult oftentimes for us to determine whether an antibiotic is actually going to work or not. So I know there's all this hype about Mycoplasma pneumonia, and yes, the rates in hospitalized patients are going up. You have to remember Mycoplasma pneumonia is a bacteria that most people will fight off on their own. However, it might take a few weeks to a month, sometimes longer, and it causes these low-level lingering symptoms. Chest x-rays often lag behind clinical signs and symptoms 3 weeks or longer. So most of the time we won't see anything on chest x-ray in mildly ill patients until they've been sick for at least 3 weeks or longer. Also, you have to remember that hospitalized patients don't necessarily represent the general population, right? A lot of the patients that we take care of in hospitals have other underlying issues that compromise their immune systems that are chronic, like diabetes that's out of control, heart disease, lung disease, COPD, and this all makes their immune systems more compromised to get severe infections with these types of bacteria that oftentimes otherwise healthy people will fight off on their own. So I did some research, and as per the CDC website, and whether you like the CDC or not, it is pretty good for tracking data. The highest level of circulating virus in the community right now is rhinovirus, and it's actually pretty high. Rhinovirus is a virus that just simply causes the common cold. However, believe it or not, it often causes symptoms for about 2 weeks for most people. So take me, for example. I've been sick for 7 to 8 days, and Thanksgiving's coming up. I'm getting on a plane to go someplace nice, and I don't want to feel crappy. So at this point, do I take an antibiotic or not? Well, if I choose to take the antibiotic and I feel better within 48 hours, how do I know that the antibiotic actually worked? Or maybe it was just a natural course of the virus that on day 10, 11, 12, I start to feel better. We'll never know. Let me just leave you with this. Things that are not normal when you have the common cold are extended fevers, meaning they're lasting longer than about 5 to 7 days max. A fever is defined as greater than 100.4 Fahrenheit temperature. Severe chills that are lasting beyond 5 to 7 days. An oxygen level that in an otherwise healthy person is less than about 96 to 98%, and you can easily check this with a pulse oximeter. You put it on your finger, you can get it from Amazon for less than $20. It's a great tool to have around. It will also give you your heart rate. I'll be posting another video on some simple tips and tricks for the common cold just to make you feel better and weather the storm, and why you should probably simply just not waste your money on most of the products in the cold and flu aisle. Happy Thanksgiving, in peace and health.